and welcome to Deuk Spine Institute. I'm Dr. Deuk Machen, CEO and founder. I'm a neurosurgeon, board certified, 29 years of experience, and we are performing live spine surgery for your pleasure and the patients. This patient comes from Canada. It is, as I said, June 17, 2025. It's our last surgery of the day. I'm going to put a little bit of numbing medicine under the skin. Now, he's had back pain for 20 years. And when I asked him where his pain was, he said it goes across his back right here. When I looked at his MRI, he was pointing to the L4-5, and the MRI showed that there was indeed damage to the L4-5 disc. So I realized that his disc was the cause of his back pain. And there's 30 different causes of back pain. The L4-5 disc is the most common of all 30 causes. And this patient has that. So that said, we recommended repairing the disc with laser to get rid of the back pain. And he agreed. He traveled from Canada. He's here for 3 days to have the Deuk laser disc repair. That is the best treatment in the world for this problem. Sean? There is nothing better. Now you can also do fusion, but who wants a fusion? Fusions have bad results. But he chose this procedure, and he chose wisely. This procedure has the highest success rate of any treatment in the world at curing back pain. It's the only treatment that cures back pain that specifically targets back pain at its source, a tear in the back of the disc. Shot? All right, we're ready. We're just about ready to test the disc. We do what's called a discogram. This is where I verify that this disc is the cause of his pain. Now this is how much blood we're going to lose for the whole surgery. It's bloodless surgery. We are going to make a 4mm incision. If you have questions, by the way, type them up in the dialog box and I'll do my best to answer them.
Okay, open your eyes. We're going to ask you some questions. Okay, good. Good. All right.
Are you having any pain right now? Our patient is currently awake. Are you having any pain?
Are you having any back pain, sir? Yes or no? What did you say? Hello?
You having any pain? Look at him. He's moving. How bad is the pain there? Show us the tear, Jordan. Sean?
1 to 10.
Okay, there it is. So you see the cotton ball in the middle of the disc. That's, circle the whole cotton ball. The dark stuff, that is where the dye is supposed to stay. But look, it's leaking out through a tear in the back wall of the disc, and it's leaking out into the epidural space. And when we injected it, he started moving around like he was in pain. So we know that this disc is the cause of his back pain. I feel very confident his pain will be gone at the end of this surgery. Henry, have we started the 30 causes?
Not yet.
Let's do that now while we get started here.
Of course.
I'm Dr. R. Deuk Machen with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Welcome back. You can see there are 30 specific causes of lower back pain. At Deuk Spine Institute, we are leading the world in the diagnosis and treatment of back pain and neck pain. This patient has one single solitary cause. And the average patient that we see has 4 causes. This patient has 1. His cause is the 045 disc. And he has the blue stuff here is degenerated disc. And if this disc was normal, there would be no blue. There would be no blue. But because it's staining blue, it tells me it's degenerated. We don't have much time left. We only have a few minutes. So if you have questions, I recommend you ask them now. We're going to be done with this surgery in about 5 minutes. Any questions?
At this moment, no current questions.
All right, I'm using the laser. The laser fiber is 1 millimeter wide, just to give you a reference as to how big it is. And what I'm doing is I'm using laser energy to remove the herniation here in the tear, also to remove scar tissue and blood vessels and nerves that should not be here. We call that inflammatory tissue. So by getting rid of these abnormal tissues, we're performing a treatment called debridement, spelled Debridement. If you know somebody who has pain in their back, and they're living with it, we can cure it at Deuk Spine. We just need to do a 10-minute Zoom call to establish the source of pain and then to come up with a treatment plan based on the sources of pain. This particular patient, when I did his MRI review, he was in Canada. How many Canadian patients do we have today? 2 or 3? I think we had 3 maybe, right?
2. One from Cincinnati.
All right, we had Cincinnati. We had a few Floridians. We had a few Canadians, a Coloradian. Anyway, this particular patient, when I interviewed him and I did my Zoom call, I realized he only had pain coming from this disc, not any other structure. I tested his SI joints with him, with his help. I tested his piriformis, but he didn't have any piriformis pain. He didn't have any SI joint pain. He just had disc pain. So based on the MRI and the physical exam that I did over Zoom, I was able to diagnose his pain source, recommend his treatment. Then he flew down here, and in basically 3 days of his life, he gave up 3 days to come to Deuk Spine and get fixed, and that's what we're doing. I didn't see anything else causing pain, so I expect when he's done, he's going to do fantastic. I worry a little bit about him because his job requires him to lift things, and I went over his post-operative lifting instructions very carefully with him, but you never know. Some people just ignore the instructions and the restrictions that we have, and they just do whatever they want to do. I hope he's not going to be that way. Any questions?
At this moment, no current questions.
All right, we got about 2 minutes left, and we'll be done. The entire surgery is done with a small incision in the skin that's 7 millimeters or 1/4 inch. This patient is going to go home today right after his surgery. He's going to recover for about an hour and then basically go back to his hotel. And if he lived close by, he could go home. We'll see the patient back in the morning for a quick checkup. And after the checkup, patients can fly back to Canada, go to their permanent residence or wherever they want to go. But this is outpatient surgery, and it does not require hospitalization.
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain and how it is that we cure it.
I love that, Henry. It's a great suggestion. Thanks so much.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4 inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the disc causes back pain through a process called inflammation. It's where your body starts to attack the actual herniation itself, trying to get rid of it. It's just trying to do its job. But that inflammation ends up causing a lot of pain and suffering for the patient while the body tries to heal the herniation. Problem is, it can never quite heal the herniation. The herniation is not healable by your own body. And there's lots of things the body can't do, right? If you have cholera, an infection by a parasite, or giardia, you can't get rid of the infection on your own. You may be super strong, fit, take all kinds of supplements. You may be young and healthy, but you cannot clear an infection. You need antibiotics. If you have, something horrible like cancer, you can't just wish it away and hope that it goes away. You got to treat it. Same thing with herniated discs. They're not going to go away on their own. They're not just going to stop hurting on their own. They may get better for a little while. You may get less pain for a little while, but the pain will always come back because the source of the pain is not being addressed, which is the tear and herniation, as you guys just saw in the video. But Deuk Spine Institute, we pioneered the very first treatment for back pain from a herniated disc that directly targets the source of the back pain. And that is what we're doing right now with this laser. Look at that fat right there. You guys see the fat?
Yes, we do.
That's fat. It's kind of pretty. It's kind of a whitish fat. It's not your typical yellow fat. But that said, just about done. I know he's just now starting to wake up, and that's okay.
We do have a question
Sure.
coming from the classic car nut on YouTube,
Yes, classic car nut.
asking, is it the inflammation or compression or both that causes lumbar radicular symptoms? Hope all is well. And also, when does the movie come out? Thank you.
Well, Classic Car Nut, you are asking a great question. So Classic Car Nut asked Dr. Deuk, when people get leg symptoms down their leg, whether it's weakness, numbness, pain, tingling, is it because of inflammation or is it because of pressure? Is the herniation putting pressure on the nerve or is it inflaming the nerve? The answer is both. But most of the time, if you're having leg pain, then it's from inflammation on the nerve, coming from the herniated disc and the inflammation from the tear. Okay? If it's weakness, numbness, and tingling, the most likely explanation is pressure. The herniated disc is crushing the nerve root. I got about 1 minute left. As far as the movie goes, trust me, there's not a week that goes by that I don't harass my director/distributor. These things take time. I am wanting the movie out just as much as you do, if not more. So I'm still waiting. My distributor happens to teach a film class at UCLA and at University of San Diego, or San Diego State maybe. Anyway, so he's a busy man. He makes movies. He also teaches how to make movies to up and coming directors and producers. So he has other jobs to do, but All I can tell you is I'm waiting patiently just like you. I don't have a date yet, but it'll be, trust me, as soon as I get a date, you all will know first. The movie's done, by the way. I watched it again over the weekend. It looks great. It's a great movie. It's designed to be a pilot movie so that we create a series. We want to expose the insurance companies and the medical device companies all in one series. So that's what we hope to do. Raise awareness of what's happening, all the corruption in healthcare through our series. That said, we do have a podcast that we are starting at Deuk Spine. That podcast is the Deuk Spine Institute podcast. And Henry and I just shot the intro, and we shot the first podcast just a few days ago.
Our
right?
first episode yesterday. Yeah.
Yesterday. So we're going to edit and have that podcast probably available in a week. Right, Henry?
A week, no later than 2.
So you guys can start watching our new podcast on Spotify.
We'll have it distributed not only to Spotify, but we'll also have the episodes on our YouTube channel for anybody to watch them there instead, and then to anywhere you get your podcasts as well.
Yeah. All right, folks. Well, I'm amazed because when I did his MRI review, his MRI doesn't look that bad. But now that I'm in here, this is pretty bad. I mean, there's a huge tear, much bigger than I expected from the MRI. The MRI didn't really show much of this. But now that I'm fighting it and cleaning it, it's quite extensive. It doesn't matter. It will heal up just fine when I'm done. And his pain should be gone. As soon as he wakes up, it'll be gone. He will have a little discomfort from the surgery. But other than that, he's going to do fantastic. And his back pain that he's had for all these years will be gone. All right. Any questions for me from our audience?
No current questions, just a comment from the classic Carnut once more on YouTube saying, great, good luck with the podcast.
Hey, thank you so much. And Henry, since we're pretty much done here, why don't we show our new video that you created comparing the Deuk laser disc repair to other treatment?
Of course.
Hi, I'm Dr. Deuk Majan. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts